for the first video of nursing, 2439 in the fall for distance learning. My name is Alexa Wood. My student ID is 3388636. Okay, so now we're going to listen to lungs. When you listen to lungs, you want to make sure everything sounds clear and there you can distinctly hear inspiration, expiration, and there's no accent sounds, there's no crackles, there's no rasps, there's no like high-pitched kind of noises in there. And to do that, you want to listen to all four lobes on each side. So for small dogs and cats, you kind of go in an H pattern. So you'll start like here, and then you'll go down to here, and you'll go in the middle, and then you go back up like this, and then down like this on both sides. And then for large dogs, it's a tic-tac-toe grid, but you go through the whole grid, if that makes sense. So 1, 2, 3, 4, 5, 6, 7, 8, 9, if that makes sense. So since Duncan here is a cat, we'll start on both sides and we'll do that H pattern. Good boy, Duncan. So we'll go up, down. Good boy, Duncan. Middle, up, okay, that side sounds good. Come here, Duncan. Good boy. So we're gonna go up. Good boy. Down. Good boy, Dunk. In the middle of our H. Bottom. Good boy. Last one, Dunk. Good boy, Duncan. So he was purring the whole time, so it's a little hard to hear, but there was no wheezes, there was no crackles, there was no anything to be concerned about with him. He's a very healthy, good boy. Okay, this is Duncan. He's going to be my example for listening to his heart. So to listen to his heart, you either want him standing or sitting, kind of whatever he prefers. So when you're listening to the heart, you want to listen to both sides, and you want to make sure that everything sounds consistent. Everything sounds the same. So a lub dub is one heartbeat, and then you want to make sure that like I said, everything is consistent. Everything sounds the same. The things we don't want to hear is going to be like a whooshing sound that indicates a heart murmur. We don't want the lub dub to be inconsistent, too close together, too far apart, anything like that. So to do that, we're going to take our stethoscope and we're going to listen. Up, 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 Dunk. Good boy. And we're going to put it right in his axillary area on the left side, and we're going to listen, make sure everything sounds good, and then we're going to come over here to the right side in the same place, right up in his axillary area, and make sure everything sounds okay on that side. Hi, Duncan. He's a good boy. Good boy, Bubba's up, up, up. Good boy, Dunk. Hang on, Bubba's. Good boy. Good boy, Duncan. So both sides sound the same. Everything sounds good. I could hear your heartbeat through your purring and your trembling, sir. So he sounds good. There's nothing to be concerned about with Duncan. Okay, so this is my rabies pole demonstration. This is our rabies pole that we have here at the clinic. The reason why we would need to use this is especially if a dog is suspect of rabies and is coming in, or if a dog is super aggressive and not even the owner can handle it, to put a muzzle on. So this down here is how you control it. So this is how you tighten in the loop. You just pull it to tighten, and then there is a little silver knob right here, and you pull that, and it loosens up that loop. With the rabies pull, you want to go be behind the dog, and it's just really quick, right over their head. You pull real quick to tighten it up, and then you're able to keep the dog at a safe distance from you. You do want to be careful though, because dogs can always, they can flail, they can jump, they can try to like snap and turn and get away. You don't want the loop to be too tight, or if any of that happens, you immediately want to release the pull so they don't accidentally choke themselves. So I will demonstrate how to do a rabies pull. So this is my demonstration on a rabies pull. This is Zoe, she's my own personal dog. So like I said, you want to be behind them when you do the rabies pull. So then we're gonna slip this, slip this over their head, and we're gonna pull this tight. And then they are far enough away and we can maneuver them just like that. Okay, so this is my video on how to properly clean a cage. So we have an empty cage that my dogs were actually in tonight. So we clean those not only after, surgery patients leave, boarding patients leave, also if our own dogs are here for the day for something. So to properly clean a cage, you use Sentinel. This has been properly diluted for cleaning. This is just like the normal dilution and not the Parvo solution. The Parvo dilution for Sentinel is a lot stronger than the normal one that we clean with. So according to the back of the Sentinel bottle, this has been properly diluted, and then we spray this all over the kennel. So we do the top and we do all the sides, we do the bottom, and then we also do the cage door here. We let it sit for 10 minutes and then it air dries, and then we wipe everything out. Before you even use the Sentinel spray, you want to make sure that the cage, kennel, whatever it is free of debris. So there's no blankets, there's no vomit, feces, there's no urine sitting in it, nothing. So we'll spray both the sides, the top, the bottom, and then we'll just get the latch there, and then like I said, we'll get the door here too. Okay, and we'll let this sit for 10 minutes, and then the way you wipe it out, you want to go top to bottom. The reason why you go top to bottom is so if anything drips from the top, you're not re-infecting anything or re-cleaning something at the bottom if you would start like bottom to top, if that makes sense. And it's just more of a systematic way to make sure that you're not recontaminating anything in the kennel. So we'll let this set for 10 minutes and then we'll be back to wipe everything down. Okay, so it's been 10 minutes and now we're ready to wipe down our kennel. So again, we're gonna start top, the sides to the bottom, and then we'll do the door last. So we'll start with the top. Okay, new paper towel, we'll do all the sides. Okay, new paper towel. Do the bottom. Okay, bottom's done. New paper towel. We'll get this latch over here. Side of it too. New paper towel. And do the door real quick. a new paper towel. Last but not least, we'll just wipe up everything on the very, very front. And that's how you properly disinfect. This is Zoe. She is a, how old are you, Zoe? 3. She's a 3-year-old female spayed beagle. She's my beagle. So we are going to express her anal glands. I have my gloves, my lube, my wipes, and then I have some XO spray for after. So to do anal glands internally, you want to put your gloves on. You want to put just a little bit of lube on your finger, gently insert your finger into the rectum, and then anal glands are typically at like a 4 o'clock and like a 7, like a 4 and 7 position. So when you do it, you just want to go in, kind of feel where it's at, and then you kind of want to roll kind of out towards the anus like this to express it. And then you just swivel over to the other side like this and kind of do the same thing. Zoe doesn't empty her anal glands like she should for some odd reason. So we have to do this usually about every 3-4-ish weeks. So she knows the drill. She's used to it. Huh, Zoe Bear?
Give you a hug.
Baby's gonna give you a hug, sis. And we're in, and we're feeling. There's her left one. We just want to kind of gently. Okay, and then we'll move to the right one. And then sometimes you kind of got to brace the outside of the anal gland with the inside. So there wasn't any in the left, but her right did have some material in it. It expressed easily, normal material, normal, so that's good. Take our gloves off here real quick. And then sometimes when you do anal glands, when you insert your finger, it actually rolls the opening away. So sometimes you have to come back just a titch to get that opening to face back out. One of the older technicians kind of gave me kind of like a pointer of you almost hook your finger kind of like this. And then you put that anal gland right in the crook of your finger so it doesn't slip away from you. So good job, Zoe. Okay, so this is topical flea preventative. To put that on, demonstrate how to do that. This is just a mock. My girls are actually on NexGard, so they don't get topical flea preventative. So we're just gonna pretend. So to do topical flea and tick preventative, any topical medications, anything like that, you want to make sure that you part the hair all the way down to the skin. You want to do that so the medication can properly absorb and they get the right amount of the medication. If anything is stuck in their hair, it's not going to absorb, and as far as flea and tick preventative go, they're not going to be fully protected. Especially for cats, you also want to put it kind of high up on their neck, just so it doesn't get licked off. And then you don't want to bathe them for roughly 2 to 3 days after they have their preventative on, because if you bathe them, then you'll just, before the 3 days, you'll just wash that preventative off and it's null and void. So, Hanzo. Okay, so we'll part, so like I said, we're gonna go high up on her neck here, so she can't lick it. My other dog in the house won't lick it. So we part all the way down to the skin. And when it comes to flea and tick preventative, you just want to double check the packaging, whether it's one that just goes all in one spot, or it's one that goes neck to tail. So we are all the way down at the skin, and we're just going to squeeze out the whole container down to the skin. Make sure you get the whole container. And then once the whole container is empty, you just kind of use the tip of it and kind of put the hair back, and then bingo bango, be careful where you pet the rest of the night. Okay, so this is Bella. She presented to us for Lethobel for an ear infection. So this is going to be her ear cleaning and second dose of Ocernia. She had 4+Cs in both ears. Bella doesn't like her ears touched, so she does have a large muzzle, and she's on 250 milligrams of trazodone as well before her appointment. So typically when we do ear cleanings, we have Bella. Hey, you're okay, sis. We have ear cleaner, but per her doctor's orders, she doesn't want us to do the ear cleaner, so she just wants us to really clean out her ears without the ear cleaner. So we'll do that. And with dogs with hairy ears, sometimes they get really bad ear infections, and sometimes they don't. It just kind of depends. Some dogs require, you know, to pluck the ear hair, some dogs don't. It just kind of depends dog by dog. I know, Belle. I know. So when you do ear cleanings, you don't want to go down too far because you don't want to touch the eardrum. But you do want to try your best to get all the cracks and the crevices in their ears, not only down in their ear canal, but also kind of up towards their pinna. I know, Belle. I know, sis. Good girl. I know. Good job. Okay, I'll do the other side real quick, and then we'll put in her. Good job, Belle. You're doing a very good job, sis. Good girl. Good job. Oh, it's gonna make you feel better. Good girl, baby. One more wipe. This one's not as gunky. Good job, sis. Good girl. Very good girl, Belle. And get your crevices, sis. Good job. Good girl. Okay, so Ocernia. So sometimes this kind of burns, so she might kind of freak out a little bit. So when you do ear medication, you kind of want to pull the ear up like this. I know, sis. And make sure that you get down into the ear canal. So we're just gonna, I know, Belle, we're almost done, sis. Hang on. Pop this open. Pick up her ear. Make sure she is down in her canal. Squeeze all the meds out. Good girl, Belle. And then once squeezed, we're just gonna rub that in a little bit. Good job, Bella. Good girl, sis. Good job. One more, sis, and we're done. You're almost done. Almost done. You're doing so good, Belle. Trazodone is great. We love trazodone. Okay, so same thing for this ear. Open our Ocernia, pull her ear up, find her ear canal through all this hair. I know. Down in her ear canal. Hang on, Belle. You're lucky I got all that in there, sis. Rub, rub, rub. Good job, Bella. Okay. So now that's done. She'll be back in a month and we'll do a recheck ear cytology to see how her infection's going. So this is my cat ear cleaning. This is Venus. She is our 7-month-old foster that one of our technicians is fostering. Since she was a feral cat, she did have some ear mites and stuff going on. Now she has a little bit of a yeast infection in both ears. So we're gonna clean out her ears, and then we're just gonna put a little bit of her Mamotomax in. So to clean out her ears, I know with Bailey, Dr. Benson's expense, for my dog, Dr. Benson specifically said not to use the ear cleaner, but for Venus, we can use the ear cleaner. So we just have ear cleaner, and we're just gonna kind of pull her ear up a little bit, drop a few drops in, massage that, do the same thing. I know, sis, I'm sorry. To the other side, few drops. I know, let me massage. Okay, shake. Good job.
There you go. Don't run away.
Okay, and then same thing, just like the dog ear cleaning, you kind of want to hold their ear so you can get down in their ear canal, and then just gently scoop around and get all the gunk out. Use a new Q-tip every time, and you want to get in the ear crevices too, up by their pinna. A little bit of gunk in there, sis. And when you clean in the ear, you don't want to go any further than the very top of the Q-tip, because then you don't want to hit their eardrum. So just one more good scoop. Good girl. Okay, there's the one. Let me see the other one. Pull that ear up. I know, so it's a good girl. Clean, clean, clean. Good job, sis. Let's get your crevices. Good job, Venus. You good? One more time. Good job, sis. Okay, shake her momentum max really good. And the doctor directions are just a small amount in both ears. So again, just like the Claro for our dog the other day, twist the top open. And make sure you want to get the tip down into her ear canal. So again, just holding your ear kind of up like this. Now I know, sis, come here. Into the ear canal, little squirt. Massage, massage, massage. Ooh, ooh, ooh. Wanna shake? No? Okay, let's do the other one. Come here, Sister Sue. Up, down in the canal. Ooh, you shook me out. Little squirt. Massage, massage, massage. Oh, I know, sis. Good job. Close the top. And then Mel, the foster, will clean her ears at home tomorrow and do the same thing over again. Okay, so this is my canine nail trim. Zoe is actually pretty good at nail trims. She doesn't need much restraint. But some dogs have to have more restraint. Some dogs have to be lateral. Some dogs, like Zoe, don't need any restraint at all for the most part. She goes to doggy daycare and they have concrete there, so she's worn her back ones down pretty far. If I cut anything off of those, I'm going to quick her. So we're gonna work on her front ones a little bit. So, this way, because then I can pull her foot up. So when you're clipping nails, you just want to do a little bit at a time. The way you identify the quick is for black nails, it looks like a little bullseye. So it'll be black, then it'll be white, and then it'll be like a black dot in the center of it. That's the quick. Once you reach that, you don't want to go any further, or otherwise you will quick them, and that nail will bleed. And as far as the clear nails go, some dogs with white nails, you can see the quick because it'll be pink on the inside of the nail, but still, you never want to just chop. You always want to take a little bit at a time. How's it wear? Let me see, sis. Little bit, little bit, little bit. So now I'm down to her quick. I'm just gonna push on the center just to confirm, and it's squishy. So we'll move on. Good girl, Zoe. Down to the quick. Squishy. Good job, Zoe. And like I said, she runs a lot, so I thankfully don't have to take off too much for her. My other dog, on the other hand, she doesn't run a lot. And her dew claw's already down. So all of them are down to the quick. Not only can I see it, but I can also feel it because it's kind of soft and squishy. Okay, so this is my cat nail trim. This is Venus. She's about 7 months old, intact kitten. She came to us as a stray. One of Mel, our technician, is fostering her. She is under the care of one of the shelters here. As you can see, she had to have a leg amputated, so she's a tripod now, but she's a very good girl. So this is the nail trim. So for cats, it's kind of the same thing as dogs. It kind of just depends on the cat. If they're least restraint, more restraint. Here at VCA, we're fear-free, so we try to do the least restraint possible, low stress restraint. So typically she would kind of be sternal, and I would just kind of hold on to her right behind her kind of her jaw like this, so she couldn't turn, and then cut her nails. And then sometimes we can do them by ourselves, and sometimes we can't. So it just kind of depends on the cat. So to expose cat nails, I know, sis, you just kind of push on their toes a little bit, and pop that nail out. With cats, all of their nails are see-through, so you can see where the quick starts and how far you can clip. Come here, sis. We just kind of push on her toes, pop those out, and it's really hard to see, but that little pink part in there is her quick. So, Mel has been trimming Venus's nails since she's been with her, so she's really docile about it and doesn't fight very much. Let me see your tootie, sis. I know. He's gonna chew on my fingers. I know. Thank you. Push your toes out a little bit at a time, all the way down to her quick. And her nails aren't very long because, like I said, Mel cuts them pretty regularly. It's just her time to have them cut. Push your little toe out. Boop. Good job, sis. There's your quick. Grumble, grumble. Sassafras. Okay. Ta-da! And that's how you trim cat nails. Okay, so same thing applies. Come here, Pixie, good girl. With pilling a dog, just like a cat. So same thing, you want them sitting. Sit, Pix. Sit down, good girl. It's okay. You don't have to be worried. It's okay. So same thing, you're gonna grab them right behind their canines. It's a little easier with Pixie, she's a little bigger. Hold their pill in your, I know, it's a pill pocket. Between your thumb and pointer finger, open the bottom jaw with your other fingers to the back of the throat, close their mouth, rub their throat, and then chase with water. Just like with cats, same thing is you want to chase with water, so A, the medication doesn't get stuck in their throat, and B, there's no irritation, and C, it just encourages them to swallow even more. So I am right-handed, so I'm going to switch sides, Pix. Ooh, she's a good girl. So I have my water, and this is just a pill pocket because Pixie also doesn't need any medication. So hold it with our thumb and forefinger, right behind her canine, open to the back of the throat, close. There you go. Water to swallow. Good girl, Pixie. This one's for free. No? Okay. Okay, this is Venus. She is going to be my example for pilling a cat. So when you pill cats or dogs, when you do it, when you open their mouth, you want to hold right behind their canines. That'll hold the top, and then you hold the kibble with your thumb and forefinger, and then open the her bottom jaw with your other fingers. You're just gonna, this is a piece of kibble because she doesn't actually need any medication. So you just put it to the back of their throat, close their mouth, rub their throat a little bit, and then we're gonna use water just real quick. And then after you rub a little bit, and then you just put a little bit of water into their cheek pouch to encourage swallowing. And you use the water because A, you don't want the medication to get stuck in their throat. Sometimes medication that gets stuck in the throat can cause a lot of irritation. And then secondly, the water just helps them encourage swallowing. So, you ready, girlfriend? Okay. Let me see your two things. I know. Hang on. Hang on. No water. Ooh, good girl. And that's how you pill a cat. Okay, so this is my history for a patient. This is my grandma and her significant other. They have okayed being on camera. So, all right. When did Snickers is here for not eating? When did that start?
About a week or so, about a little over a week ago. He eats just a little bit, nothing like he did.
Okay.
He's getting skinny.
What kind of food does he eat at home?
He eats dry and he eats canned.
Okay. What brand is it?
Friskies, both of them.
Okay, how much of the dry does he get?
It's just got one of those things that he can eat whenever he wants.
Okay.
So
How much can does he get a day?
just one.
Okay. Is he on any medications, vitamins, supplements?
No.
Okay. Is he still drinking like normal?
He has slacked off today and yesterday. He hardly drinks anything.
Okay. How's the litter box?
He doesn't have a litter box. He goes outside. He won't go in a litter box.
Okay, so he's indoor, outdoor?
Yes.
Okay. Have you seen any coughing, sneezing, vomiting?
No.
Okay. Is he on anything for heartworm and flea and tick preventative right now?
No.
Okay. Has he been extra itchy at all lately?
No. But he's losing his hair.
Okay, where is he losing hair at?
Mostly in the back by his tail and his back haunches here. He sheds terrible. Big clumps of hair.
He goes outside quite often.
Yeah,
Okay.
About every hour he goes outside, pees or whatever, and comes back in.
Okay. I know he's 12. Is he still moving and grooving okay in the house, jumping up on stuff
That's
like that?
it. The last 2 days he can't jump up on the bed.
Okay. Okay, when did you, I know you said he started to not want to really eat a little over a week ago. Has he been lethargic? Has he been
Oh,
sleeping
yeah.
a lot?
Lethargic. He gets in the dog's bed and sleeps all day and gets up, goes out, potty, comes back in, jumps right in the bed, and he don't want to move around or do anything.
Okay, did that start a little over a week ago
About
too?
2 days ago.
Okay.
He don't come to you. Usually when, in the mornings he'll go outside and then he'll come and I'll be sitting there and he'll come over and want me to play
And-
with him and pet him.
He don't want you to mess
And he's
with
not
him.
greeting anybody? Okay.
Nope,
He's not sociable.
nope.
Is he hiding a lot?
He doesn't hide. He's either in his bed or on the bed, and he's not on the bed anymore. He's just in the dog
He's
bed.
usually in the front room with us
Usually in the front room.
now.
Okay.
He'll get up on the couch. He can get up. Well, he can get up on the chair.
Okay. All right, awesome. Alrighty, I will let Dr. McClory know you guys are here.
Okay.
I'm not sure exactly what she'll want to do to start off. She'll start with her exam and she'll probably recommend some blood work because this time last year he did have the pancreatitis when he was kind of acting like this.
Oh,
So,
he did.
yes.
They didn't tell me that.
So, we'll see what she thinks and we'll kind of go from there.
Okay.
Okay, so gonna give a report to Dr. McClory after getting history for Snickers. So Snickers is a 12-year-old male neutered domestic short-hair cat. He presents today for not eating, being lethargic. So the owner said that started about a little over a week ago now. He was eating just very little amounts of food, but now this morning he's not eating at all. The owner said that he's become very lethargic 2 days ago. He's laying around a lot, he's not greeting them, he's not sleeping in bed with them, anything like that, which is odd for him because he loves attention and he loves to be out. He's eating Friskies canned and dry food. The dry food is free fed. He gets 1 can once a day at night. He is still drinking, but it's been decreased the last 2 days, the owner said. He's an indoor-outdoor cat, so she's not sure about what his pee and his poops look like. No coughing, no sneezing, no vomiting, no diarrhea. He's not currently on anything for heartworm or flea and tick preventative. Before this, he was doing well at home. He was normal, moving around okay for 12. The owner did mention that he is losing a little bit of hair right at his tail head and a little bit on his hips. And then the last 2 days, he hasn't been wanting to jump on the bed, jump on the couch, anything like that. The owner did okay the vet scan, CBC, and FPL. So we'll go get blood and then you can do your exam.
Let's do it.
Hello, my name is Stephanie Hagler. I'm Alexa's preceptor for her class. Alexa's doing very well. She's completed her skills in a timely manner. She makes sure that she can get them done, sets them up, comes in early, stays late. All in all, it's going well.